And welcome to another video. This video is about common complications after Roux-en-Y gastric bypass. And again, this is exactly how I present this information to my patients in my clinic. So gastric bypass, think about these four things. Think about, actually with all the bariatric surgeries, are we malabsorption of, is that affected in terms of vitamins and minerals? With gastric bypass, that's a yes. Gastric bypass changes the way our body processes sugar or carbohydrates. And this is one of the reasons why it has a 44% remission rate of type 2 diabetes. So it's a good thing. But if you're signing up for a gastric bypass and you don't have type 2 diabetes, it's a very important concept here to understand is that you're going to be predisposed to developing dumping syndrome. Dumping syndrome, I would say commonly, if you have type 2 diabetes, you're already at a certain state of insulin resistance that it might just be balancing you out. So not everybody is going to get dumping syndrome. The medical word for dumping syndrome is reactive hypoglycemia, which means that by consuming sugar, your insulin, your pancreas over responds. So you get an overdose with your own insulin. And nobody can probably even fathom what that's going to feel like unless you have type 2 diabetes and you've overtreated yourself. And then a little bit, I'll talk about the side effects and what you can expect with that. There's also anatomic complications. Again, we're creating a new pouch, we're dividing the intestines, we're rerouting the intestines, and we do that to get the benefit of the type 2 diabetes reversal, among other things. But there are consequences. And so in order to be a person with gastric bypass anatomy and to really be worry-free, you have to know the ground rules for signing up for a gastric bypass. And then lastly, the gut health impact, which again is the art of bariatrics. Whole special sauce here is taking care of our guts. So malabsorption, by rerouting the intestines and bypassing this proximal portion of the upper intestine, you lose the ability to absorb B vitamins, specifically B12, and iron. So you don't get iron absorption as well. This can also affect calcium and vitamin D absorption. So it's really important that you take a bariatric multivitamin for life. And again, Bariatric Advantage is the vitamin of choice among our clients and our patients here in the clinic. It's the most well-tolerated and very high quality supplement. There's a delayed mixing of digestive enzymes, gastric acid, etc. And because of this, and because of the gut health implications that I'll explain a little bit later, gastric bypass patients are very prone to bloating, sometimes nausea, and abdominal pain that comes from excessive bloating. They may even complain about diarrhea or constipation. Now, most people who complain about these things, when they're following our whole foods diet and our post-operative protocols, all of those symptoms dramatically improve, but they don't go away perfectly. And it's also fair to assume that you're not going to have access to unlimited whole natural foods all the time, right? This is America. We all work, we get busy, we have kids, we travel. So just know that you're going to get a little bloating and abdominal symptoms because of the way that the intestines are rerouted. I warn my patients that because you don't have digestive enzymes and juices mixing with your food immediately, that the side effect of eating, say, a processed food, a fast food, soda, I mean, all the stuff that we kind of put in the junk food category, your body just isn't going to tolerate it very well. And so a lot of people can report feeling sick. Reactive hypoglycemia. Now, this is unique to gastric bypass and that SADie operation. What happens is sugars that normally make contact with that first portion of the small intestine, the duodenum can sense appropriately what is the impending sugar amount coming in and how is the pancreas supposed to respond with insulin. It seems as though When the small intestine makes direct contact with that much sugar, that high of a load, again, it's supposed to be digested and slowly trickle down. But with the gastric bypass or a SADie, whatever you just ate is making direct contact into a lower part of the intestine. The intestine doesn't have the same kind of receptors as the duodenum. So it thinks that you just had a crazy amount of sugar and it loads you with a lot of insulin. This causes your blood sugar to drop. And so it's very common that people after gastric bypass, if they have low blood sugar, if they aren't in communication with a bariatric surgeon or a bariatric dietitian, they will often be told by maybe their primary doctor, emergency medicine service provider, right? Your EMTs, if the ambulance comes because you're so lethargic and somnolent that your family member thinks you're having a stroke, that EMS provider will check your blood sugar, see that it's in 30s, 40s, maybe it's undetectable, and they will give you sugar. They'll put sugar in your mouth. They'll give you sugar gel. They'll have you drink apple juice. I just saw a woman in my clinic last week who had gastric bypass for gastroparesis, which is a condition where your stomach doesn't empty very well. She never had type 2 diabetes, so she's a very insulin sensitive person. She had one episode of low blood sugar because she just ate too many sugars or carbs. Maybe it was a protein shake, maybe it was a protein bar. Who knows? Maybe it was a cookie. Again, we're all human here. It's just gastric bypass doesn't really afford that resiliency or that ease of digestion with these very simple and, quite frankly, very tempting foods. So the trick here is you have a gastric bypass. You may or may not know how sensitive you're going to be to this process. You might not have it at all. We've had plenty of people come through our programs, both clinically and online, and they don't have dumping syndrome. Their favorite sweetener is a little bit of honey. They can get away with it. It's just that there's not a one size fits all. And when you're experiencing it, it's very important that you recognize I've had gastric bypass. I cannot eat sugar. One example, though, is this woman that I'm describing who was just all out of sorts. She was eating, all sorts of sugar tabs and juices to try to bring her sugar back up. But every time you do that, you tank again because the same process just keeps happening. So the best way to prevent it, and you really do want to get a mindset of prevention, is to eat protein. Eat protein, breakfast, lunch, and dinner. Make sure you're getting enough protein. At Art of Bariatrics, we recommend 30 grams per meal, thereabouts. So a very, high protein diet. And then also, if you're really sensitive, like this person was just very sensitive, then low carb tortillas or wraps, beans are probably going to be okay. Lentils are going to be okay. Slower glycemic vegetables and whole grains are probably going to be okay. But you just need to be careful with how much of that you're consuming and just check in with yourself. The thing you want to avoid is rescuing with more sugar, more juice, because that's just going to totally repeat it. And then sometimes you just have to eat more often, smaller meals more often. The side effects of this dumping syndrome, you just feel really sick. You feel like you had food poisoning. Sometimes you get nausea. Sometimes you can even get pain, but vomiting, diarrhea are very common. And then the other side effects is you get so tired, people around you, like you're almost hard to arouse. People around you think that, you're in a coma. Again, that's kind of stroke-like picture. So it is very concerning. And I just ask everybody who's considering a gastric bypass to do their homework because all of this is preventable. And that's the best part. Anatomic complications. So ulcers, right here where the pouch and the intestine are sewn together, that's called the gastrojejunostomy. This is where a gastric bypass person is really sensitive to ulcers. So ulcers happen most commonly. In fact, the ulcer rate is about 1 in 10. 1 in 10 people with a gastric bypass will get an ulcer at some point. Taking ibuprofen, Aleve, naproxen, aspirin, meloxicam, those are the common ones that come to mind. Smoking, tobacco, and even smoking marijuana. Smoking is associated with irritating the lining of the stomach. Alcohol Alcohol and ulcers go hand in hand. And alcohol in general isn't very good for gastric bypass anyway. There's actually a statistic out there that 1 in 5 people after gastric bypass develop alcoholism. There is something unique about the anatomy, just like with the blood sugar and consuming sugar and dumping syndrome. When you consume alcohol, it goes straight into the intestine. It doesn't, it naturally gets, absorbed slowly through the stomach. It goes straight into the intestine, straight into the bloodstream. And what happens is the person who drinks the alcohol after gastric bypass then starts to crave it. The cravings can sometimes become overwhelming. And then these people are drinking alone. They're drinking multiple bottles of wine or hard liquor a day. And it just becomes kind of a sad picture. So, fair warning, alcohol and gastric bypass really don't mix. Stress can also cause ulcers. But it's usually stress compounded with one of these other things or a very severe, intense stress. PTSD type reactions come to mind. Next, we'll talk about strictures. The symptoms of stricture is like you swallow something, but it just sits there. Maybe you get a little nauseous, maybe even like drink water and the water just comes back up. So food getting stuck in the pouch. A stricture can happen if there's been an ulcer, or maybe you just get this kind of hyper rapid healing around where the new connection was. Maybe the connection was made a little too tight. I mean, I've seen all sorts of things happen. Smoking has been a big factor here. But yeah, the stomach can kind of scar down. And then it's like a pinpoint hole. In general, we ask you not to eat and drink at the same time anyway. And that way you don't have food, trying to be digested or pass, and then you're putting fluids on top. That, you might feel like it's getting stuck anyway. There's also slider foods. What's a slider food? Slider food is just a food that, you don't really feel full off of. So all of those things are common foods to go to because they don't produce the symptoms of foods getting stuck. But those foods that are easy to go down, they're often the foods that promote weight gain. So stay tuned for more about that in other videos. Internal hernia. An internal hernia is where the intestines have been wide, or as in the case of that Sadie, because of the loop of intestine that comes up and then the division that creates space where the intestines are constantly moving. They're like just rolling, and that's how we move food from mouth to anus. But the bowel can twist around on those points of separation, and you can get a bowel blockage. So you'll have a lot of abdominal pain, nausea, vomiting. Again, after any of these bariatric operations, if you ever have abdominal pain, call your bariatric surgeon, go to your local hospital, and you need to get a CT scan to work this up. All of these anatomical complications can result in the need for another operation to fix them. Gut health impact. Drum roll. I know you guys have all been waiting for this. Because of the rerouting of the intestines, what happens, and again, I hope my cursor works, it should. Here in the main body of the stomach, the part that we've just bypassed, that is where the majority of the acid production in our bodies takes place. Gastric bypass bypasses that. So think about it as maybe I only have 10 or 20% of my normal acid production, whereas normally I have 100. That changes the environment in which bacteria grow. Now, we have good bugs that live in us, and we have not so good bugs that live in us. But we also have site-specific environments where different types of bacteria grow. And if a bacteria that's supposed to grow in the colon starts growing higher up the intestine, or vice versa, bacteria that normally grow in the stomach are now starting to migrate out of the stomach because the environmental conditions are broader. It just wreaks havoc on how we digest our food, how comfortable we feel, etc. So a gastric bypass, because of its acid altering effect, and also because we're swallowing more oxygen. So where you follow the red arrows, there's just a lot more oxygen in that limb. and there's more oxygen even down here, what happens is it changes the type of the preference of what bacteria grow there. This can cause bloating, and again, with more bloating, more stretch, you get more pain, and then nausea. And then, similar to that stricture picture, it feels like food just doesn't want to empty. People can get constipation. Constipation plus the acid changes really set you up for just an overgrowth and overblooming of bacteria in the small intestine that otherwise wouldn't be there. And stay tuned because we have a whole lecture that talks about what to do about this, the gut health impact before and after bariatric surgery.